Syphilis is a sexually transmitted infection, which normally starts as a painless sore. It is caused by the bacterium Treponema pallidum and spread through direct contact with a syphilis sore on an infected person's body during vaginal, anal or oral sex, and through cuts on the skin and mucous membrane. It can also be passed from an infected mother to child during pregnancy. Syphilis cannot be spread through casual contacts with objects like doorknobs, swimming pool, hot tubes, bath tubes, shared clothing or eating utensils. This is because the bacteria can't live very long outside the human body. Syphilis can be deadly if left untreated. It can lead paralysis, brain damage, blindness, hearing loss, and heart valve damage. You are at higher risk of contacting syphilis if you always have an unprotected sex, have sex with syphilis partners, use unclean needles or unscreened blood. You can also develop syphilis if you have HIV, and men are more likely to develop syphilis than women. Syphilis usually develops in stages, and signs and symptoms vary with each stage. It undergoes 4 stages which include early or primary syphilis, secondary syphilis, latent or hidden syphilis, and tertiary syphilis. The early stage or primary syphilis usually develops between 10 to 90 days after being exposed to the disease. People with primary syphilis usually have a small and painless ulcers or sores called chancres on their genitals, anus or rectum, and/or around their mouth. This sores usually last 3 to 6 weeks, and heals regardless of whether treatment is given or not. Treatment is necessary even after the sore goes away, in order to stop the infection from moving to the secondary stage. The next is the secondary stage. This stage begins 6 weeks to 6 months after exposure, and it may last 1 to 3 months. People with secondary syphilis usually get syphilis rash on their skin when the primary sore is healing or several weeks after the sore has healed. The rash can be on palms of the hands and in the bottom of their feet. This rash normally does not itch, and look rough, red or reddish-brown. Other symptoms may include fever, sore throat, patchy hair loss, headaches, weight loss, swollen lymph glands, muscle aches, and fatigue. Symptoms at this stage usually goes away also without treatment. But if the treatment is not given, it can move to the latent, and possibly tertiary stage. The next is the latent stage. The latent or hidden stage is a period when there are no visible signs or symptoms of syphilis. Without treatment, the infection will remain in the body even though there are no signs or symptoms. This stage can last for so many years before progressing to the next stage. The last stage is the tertiary stage. This stage is rare and develops as a result of untreated syphilis infection. It can appear 10 to 30 years after a person gets the infection, and can be deadly. Tertiary syphilis is marked by severe problems with the heart, brain, nerves, eyes, blood vessels, liver, bones, and joints. It can lead to blindness, mental health conditions, loss of hearing, memory loss, destruction of soft tissues and bones, heart disease, stroke, and meningitis. Pregnant women with syphilis can spread the disease to their unborn babies. And this can cause harm to the baby, and can even lead to stillbirth, that is, the death of the child before delivery, or the baby may die shortly after delivery. That is why it is necessary for pregnant women to be tested at least once during pregnancy, especially at their first prenatal visit. Syphilis can be treated with the antibiotic penicillin. But people who are allergic to penicillin can be treated with other antibiotics like doxycycline, tetracycline, and ceftriaxone.